I was next to my medical colleagues when they took them, tortured and beat them, and later released some while arresting others. I was assaulted on my way to interrogation. From the first floor to the fourth, they beat and cursed me. The soldiers struck me with their hands and rifle butts, shouting degrading insults. I experienced chest pain and requested medical treatment, but none was provided. The following day, I was transferred from the second building along with two others. The soldiers handcuffed our hands behind our backs and shackled our legs too tightly. They threw the three of us into a military jeep and drove us around for over 2 hours. During the ride, they humiliated and beat us, sitting on us, kicking us with their boots, and striking with their rifle butts. We begged them to stop, but they continued. After being moved to another jeep, we were taken somewhere else. They forced us to take off our clothes and forced us into COVID-19 protective suits. It was very cold, and they waited a long time for another vehicle to arrive. I had cuts on my arm and leg, along with swelling in my chest. They threatened me not to tell anyone that the injuries were from being beaten by the soldiers. I arrived at the prison of detained on March 30, where I remained for 85 days. There were 3 main restrictions. Our hands were handcuffed and our eyes covered at all times, even at night. And we were forbidden from speaking a single word at any time. One of the punishments involved taking a prisoner outside the yard and severely beating them. Every day, there were 2 or 3 such punishments, and sometimes they were carried out randomly, just based on a suspicion. Another punishment involved pepper spraying a prisoner in the face. There was also constant cursing and multiple cases of sexual assault, including the insertion of batons or electric rods into the buttocks, leaving signs of burns or injuries. I've heard of more than 10 such cases, and I personally examined 3 of them. During my time there, I endured around 14 such raids while being transferred between wards, which led to injuries to my testicles, chest, and eyes. One prisoner was taken to the hospital following one of these raids. Medical treatment at detained was minimal and superficial. There was no serious care. Only patients with chronic diseases received medication, and only if they had been registered as chronically ill on the first day of detention. After mid-June, I was transferred to Ofer military prison. I was interrogated, and on the way there, they beat me, my legs, stepped on me, crushed my toes with their boots, and dragged me for 2 minutes. On the 45th day of my detention, a person who claimed to be a judge told me I belonged to a terrorist organization and that I would be detained for an indefinite period. I told him I hadn't been offered any legal advice or protection to understand my legal standing. The judge replied that the charges were related to my work as a physician in the hospital, and he was wearing a shirt similar to those worn by the Shin Bet officers and was sitting in an office. Dr. Khaled Alser was released in October 2024 after being held for 7 months in detention with no charges filed against him.